Dr. Christy here from Doggone Depression. Welcome to the podcast. I have a special episode for you today. I am so honored to be joined by Dr. Gail Clifford. I'm going to tell you a little bit about her before we jump in. I have to say that she is a renowned powerhouse. She is not only a professor of medicine, but she is a trailblazing, award-winning internal medicine physician. She has been recognized as one of America's top physicians. She was named Community Speaker of the Year in years 1998 and 99. And she was the first woman physician chair of medicine at Good Samaritan Hospital. She has received numerous awards throughout her career, including the 2018 Marquee Who's Who Lifetime Achievement Award for contributions to medicine. She's a Wall Street Journal, USA Today, and Amazon International best-selling author, a produced screenwriter, and an award-winning travel writer and photographer. Dr. Clifford is also the founder and CEO of Single Mom MDs. Her organization empowers single women physicians. She shares with them proven tools and insights to help single mom physicians and single moms in general navigate the overwhelm of having too little time, money, and support. Her wisdom is unequaled and insights unparalleled. It is my honor to have Dr. Clifford here with us today. Welcome, Dr. Clifford.
Thank you, Dr. Christy. It's always a joy to see your smiling face.
Oh, thank you. I was so honored when you agreed to come on our podcast, or I should say podcast.
I like the podcast. I like the pound. I like all of the things that you're doing. It's such a valuable thing.
Thank you. Thank you so much. Anything to bring hope, healing, happiness to people who out there who are struggling. And single moms struggle for sure, but single mom physicians, you add a whole nother layer with their profession. Tell me a little bit about what got you into creating Single Mom MDs, what you do, and how we can learn from you.
Thank you, Dr. Christy. I appreciate it. Unfortunately, I became a single mom physician when our daughter was just 17 months old after I lost my husband in a car accident. So it was horrible to go through that. I was still in my 20s. The baby, again, 17 months old, and I was in private practice. And back then, private practice meant I saw patients in the practice all day in the medical office. I would round on patients in the hospital before. I would round on the patients in the hospital if they needed to at the noon hour when I didn't have patients booked in the office. And then again after work. So my workday was already 6 to 6 or 6 a.m. to 7 p.m., depending on how many patients were in the hospital. But in that job, I also had the responsibility of being on call each and every night for my patients, except for the 2 weekends a month, my partners would cover call. And I had 4 nursing homes and I did house calls. So working and being available 168 hours a week was hard enough, but after I lost my husband and that support, it was impossible. So I survived just through, like sheer grit. I know you're very familiar with just hanging on and continuing to just keep thinking you're able to work through it. But eventually it did break me, and it wasn't even that long before I was nearly dead from an autoimmune disease. And so even though it took a couple years to heal well enough, I transitioned to become an internal medicine hospitalist and changed to different hospitals across the country. But the one thing I saw throughout was that other single moms that were physicians are still struggling. And there are a lot of things, as you said so eloquently at the beginning, that other people just don't understand. They can understand that single moms have it hard because we already have the job of taking care of our kids in the house and the income, right? So any working mom, any because all moms work, right, understands that. But having that extra layer of being a physician and seeing the evils that people do to themselves and do to each other by everything that walks into the emergency room, as you well know, that kind of moral injury, especially with what's happened now with the COVID pandemic, makes it that much harder for single mom MDs. So, and it's MDs as well as DO. So I'll go back to referring to them as single mom physicians, because single mom do on the website just didn't quite identify. So I really appreciate that the DOs understand they are absolutely welcome and included. But it is specifically for medical physicians, because one of the many things I learned is what they actually studied in the British Journal of Medicine back in 2000 was what they found in the British Journal of Medicine back in the 2000 article that said that nurses treat physicians very differently. And I don't know if you've experienced this, Dr. Christie, but I have experienced that nurses treat me differently because I'm a woman than my male counterparts. So what I mean by that is really eloquently put in the British Journal of Medicine article, specifically that nurses react to doctors based on gender only when it's women nurses. So male nurses treat individuals based on the degree. They tend to treat doctors as doctors regardless of being male or female. But female nurses tend to treat doctors based on gender. So when it's a woman doctor, they want a friend or a pal. And when it's a male doctor, they have the typical respect that's been historically given to men.
Sure.
So experiencing that throughout my career has been really difficult. And most of the time I was able to really make friends with the nurses, because there are 3 million nurses in the United States, and the majority of them are awesome. But those nurses that are malignant can really take that whole eat your young to a different level. So I wanted to keep the space protected for physicians so that we can discuss the issues that we have with nurses.
That makes sense. Yeah, I can relate. I remember some interactions that were kind of tense. In fact, I was moonlighting. I was still a resident physician at the time at a small little hospital near where my residency was. And I had a gentleman come in with chest pain, and he was young. And I ordered a cardiac workup, including an EKG. And this nurse pulled me aside and said, well, if you were Dr. Joe, he wouldn't have ordered all that, because this is a young, healthy guy. And I said, well, I'm not necessarily looking for a cardiac arrest or MI. I'm thinking pericarditis. And I still think a cardiac workup is necessary, but I had to justify my decision-making. Didn't respect, my decision.
And I think that's so true and so difficult. And I think that's one of the things that we can really take away with us. I remember back in medical school, I went around to the people that I trusted and that I thought of as successful and said, what's the best thing I can do? Because I was going into a surgical residency. That really helped me understand by my mentors, what should I do? And they said, be kind to the nurses, work well with the nurses, because if you don't, what they said was specifically, quote, they'll kill you. Okay. So in the surgical residency, the thing was to really make peace with them and to over explain. It's almost like mansplaining. You have to say, I'm ordering this EKG because I'm concerned about pericarditis. And it's so ironic to me that it's mansplaining to another woman to get them to understand, but ultimately it's about education. So
Right.
If we educate the nurses, for me at a new place, especially as a locums when I work, I try to identify the stars and the people that will help me most. And I make sure that I befriend them and I over-educate them and I over-explain things. And I let them share as much knowledge as they have. And that helps me tremendously. And it also helps us connect on a personal level, which is wonderful. But that tends to smooth the road. But that didn't help me back in 2003, when in the middle of the night during a code that I'd been working on for literally hours, a nurse, after the code was successfully completed and the man was brought back, instead of putting the CPR board down in front of her like she was supposed to, she threw it over the top of the patient and it crushed my leg, which led to my being in a wheelchair for 10 years. So it's that kind of horrible. And that nurse never even had to say she was sorry. She said, yes, I acknowledge that I did that. But she never once had to actually apologize. And even 3 years later, when they had HR sit us down, she still would not apologize. And that really changed my life forever. Spending 10 years in a wheelchair, gaining 80 pounds, it's the kind of horror that is just a terrible story. And you don't ever want to. So whatever reason we're disabled, whether it's by people's vicious actions like that nurse, or just, when my husband died, the depression that caused, and that fear. For me, I continued to work through it and muscle through it, but I know I still suffer today because that was necessary. And that's
Wow.
what I'd like to help other single mom physicians avoid.
Sure. Tell me a little bit more about the depression and how you worked through that and out of it.
Absolutely. Thank you. I, anybody who suffered the loss of a spouse or a parent or, God forbid, a child, understands loss. And so add to that loss the financial burden, the lack of time, being available 168 hours to everybody else in the area, but not being able to take care of my daughter when she was sick or needed me because everybody else had to come first. I recognized that was where I could draw the line, and I could legitimately draw the line. If my daughter needed something, then everybody else had to wait, but anything else didn't. But my partners at the time, their answer to when my daughter was sick was to make a little pile of blankets and have her in the corner of my office. Back then, we still had nice offices, individual offices with the pretty desk and the nice wallpaper and all the things that a budget of that type could afford. So
Right.
she could be with me, so to speak, but they still expected me to see 20 or 40 patients a day.
Right.
Plus going to the hospital for rounds before and after work.
So
So dealing with it really was just pushing through in 100% survival mode.
how do you see that being perhaps different today? Would it have been easier to set boundaries today and to put your foot down?
I do think it is for two reasons. One is that our schedules are very different. It's incredibly rare for people to be in private practice and do office and hospital and nursing homes and house calls and be on call 100% of the time. So that's one thing that makes it better. The other thing is I think employers are generally better about not allowing that, and there's better access to daycare and additional help. So I think those two things help with just that part of the overwhelm. But I think a lot of women still need that mindset change and understanding that we spend our entire lives helping people and
Mhm.
offering help. And yet, don't we see it as a weakness when we need help?
Hmm.
It's like, well, that makes me less than. But I was just reading one of Dr. Brene Brown's books, and she's like, I challenge you, if it means that you're less than, does that mean if you're offering help? It's not that you're more than, does that make that gift less valuable? So it really made me stop and think and say, I do need to accept help. And I think that's part of what all of us as humans need to do. But single mom physicians in particular need to be gentle with themselves, to
Mhm. Mhm.
understand when they need help, and then be brave enough to ask for it, and then courageous enough to accept it.
Yes, exactly. And that's one of the things I encourage in my own program, working with people with anxiety and depression, is to ask for help and to set boundaries around your well-being. And what I mean by that is it's very easy to get caught in that um, frenzy of needing to be all things to all people. I have to do this for my work and this for my kid and this for my husband and this for that I do, and to leave no time or little time for self-care and self-reflection and rejuvenation. So one of the little assignments I suggest to my people who are finding themselves pulled in a million different directions is very simple. I tell them to give 80% effort instead of 100 every day, and to learn to say no and practice saying no at least once a day to something that they could easily say yes to, but to say no anyway.
That's a perfect exercise. And I think the value of the word no is underestimated. And that's also part of one of my programs and part of one of my topics. It's claiming your time, because
Yes,
everything you say yes to means you're saying no to something else.
that's
And
right.
maybe self-care,
Yeah.
but never minimize the importance of self-care.
The better you get at saying no, the easier it is to say yes to what you really want to say yes to.
Yeah, that is so true, because it's not until I think you know what you really don't want that you can start really narrowing down on what you really do want.
Yeah, and the other thing is you don't have to get a buy-in from the person you're saying no to or explain yourself. I think a lot of times, I know myself, I'm guilty of setting a boundary, saying no to something, and then needing to feel like I needed to get their buy-in and approval in order to do it.
It's so true.
I realized no is, and it doesn't need explanation. And
You're so right. No is a sentence.
yes.
It doesn't need justification. It's kind of like when I was young in practice, my dad would say, when you get the answer yes, get out. Don't do anything else. Just take the yes and run. It's kind of like that. When you say no, get out.
Yes.
Get yourself out of that situation, because I don't know if it's everybody or if it's just men, but don't they expect that if they just niggle you a little bit more and say, but please, we really need this, eventually you cave, because most of us do.
Yes.
And there's times that makes a big difference.
Because we're wanting their approval or buy-in, as opposed to setting the boundary and then walking away.
Right. And all we're doing is allowing them to interfere with our boundaries. And I haven't yet found a great resource for boundaries, but I do know that if my saying yes to them means I'm saying no to something I value, then that's a bad choice.
Mm-hmm. There's actually a great book by Dr. Henry Cloud. It's called Boundaries.
And I haven't gotten that one yet, but it is on my list. So I appreciate you mentioning it. I've done a lot of his other books, especially the one that the architecture of this building that was created in the mind of a toddler, like a 17-month-old child. So I really enjoy his book. So thanks for mentioning that. Were there key points from that helped you and that help your clients?
Yeah, I just think permission to set boundaries and recognizing what the deleterious effects of not setting boundaries can be. We're human and we can only do so much. I remember this one day, my mom came up to me and she took her hand and she slapped me on the chest. She goes, "Here you go." And I said, "What is that supposed to mean?" She goes, "That's your award." And I'm like, I still don't understand what that's supposed to mean. She's like, "You're doing everything for everybody and you're pulled a million different miles in a million different directions. Here's your reward." And it kind of made me pause. I'm like, wow, I am allowing myself to be pulled and to overcommit and not take care of me. And for what? Am I looking for some pat on the shoulder, some award, some reward? And I realized that maybe was a little bit of a factor as I was looking for the, wow, thank you so much. You're so amazing. We couldn't do it without you. As opposed to generating my own self-worth from internal, as opposed to doing all the things I did and do. I remember feeling like my self-esteem was wrapped up in my doing, how many people could I save? How many accolades could I acquire is what fueled me and eventually led to burnout and exhaustion.
It makes perfect sense to me. I tried, especially with having a young child, I tried really hard to accept the offers that were meaningful to me. Like being chairman of medicine, I actually knew that was going to make a big difference for the entire community. That was a big deal. Being the chair of the ethics committee when I worked for one of the baby Mayos, that was a big deal. And that was something that I enjoyed. But when I was first in private practice and they put me on the pharmacy and therapeutics committee, I'm like, I did not do well in pharmacology in medical school. Like, who needs to now? We use our valuable pharmacist, right? I have a general idea, but do I really need to remember every brand and generic name? So pharmacy and therapeutics committee was like, no, that just hurts me. So as much as people that love drugs that's great. And I appreciate you. I really do. But that's just not where I find joy. So doing ethics brings me joy. Ironically, utilization management and quality review, quality assurance, those bring me joy. So those are the things that I do. And those are the things that got me to all those accolades and led to my doing my master's in medical management and the mini MBA. So those were things that I found fun, but it was a run during the day. It's still how do you take care of your child and your patients and your studying. But once you get into a rhythm of it, especially as a hospitalist, it was like being on vacation. First switching from surgery to medicine, I was like, I can get my nails done. And then going from that to 168-hour weeks to being 84 hours every other week. That's a huge difference.
Yes.
So becoming a hospitalist and having that lifestyle allowed me to study when my daughter was in school. So it's the days that I worked, but much more meaningful and manageable on the days that I didn't.
And you touched on a few really key things right there. One, you said joy, the word joy, that you actually made an effort to seek out things that brought you joy. And I like to live by the motto that if it doesn't add quality to my life, then it probably doesn't need to be in it. Yeah, and the other thing was recognizing that you needed to make some changes, some tweaks in your schedule, in your choice of medicine, even in order to have a more balanced life.
It's absolutely true. And becoming a hospitalist was a wonderful thing. It's so much better to me than private practice because you can still be everything. I actually refer to it as like it's like being a surgeon, but still an internist because the patient comes to the ER doctor calls you, or the private practice doctor calls you from the office, and they directly admit. You see the patient for a specific period of time. You get to identify what they have. You diagnose them, you set the treatment plan, you start scheduling for discharge on the day of admission, you round on them for however many days, you run, you get the test done, then you safely discharge them to somebody else. So even though it can be several days, or with COVID, several weeks, it's still a very specific period of time, and then you move on. And yet you still get that continuity of care with the return. Don't we call them the return offenders? When that patient comes in with CHF or COPD or some other medical cause, and if you know their allergies the minute you see them, let alone their medication list, they are seeing you a little too frequently. So we have that continuity of care.
Yes, we call them frequent flyers in the emergency department.
Sure. And yet they don't get any loyalty points from the hospital, do they?
Oh, they sure don't.
Maybe that should be the next patient experience thing we do.
Here you go. We'll put that on the Press-Ganey scale.
Wouldn't that be something? Either that, or for all the nurses that are trying to do the CHF programs at home. Be like, okay, I can't do this unless you do, if you follow everything and you still go in, we know that it's your body getting worse. If you're not doing them, we know you can contribute to a better health and better life.
Sure. Oh, yes, definitely. Definitely. So I'm curious, what kind of advice would you give young physicians coming out of residency who are single moms and they're, entering into practice as the attending for the first time? How would you encourage them to, from the beginning, from the get-go, to set a work-life balance so as not to get caught in some of these scenarios like you described early on, where you couldn't even be home for your sick child? Like they told you to bring your child to work.
Right.
What can they do from the get-go to set off on the right foot so they don't end up in situations like that and don't end up 10 years down the line in major burnout, wishing they never gone into medicine?
That's such an important question. And I really like the way you phrased it, because the first thing I do is I try and help them reframe when they're part of my program or they've been my residents and are moving off into practice. Reframe, change from work-life balance to life-work balance, because life needs to come first. Okay.
Amen.
And then especially because if you have the kiddos, because you're talking about a single mom, right?
Yeah.
If you've got the kiddos, you've got to make sure that they are safe and protected and have all of their Maslow's hierarchy of needs. So make sure that they've got safety in their home, in their school or their daycare, and their after school activities, and make sure they stay engaged, and make sure that you cuddle with them every day, that you tell them that you love them every day and have time with them, have time out in nature every week. Plan something, whether it's just 5 minutes, 15 minutes, half an hour for every day, that you can find fun as a family. Something that brings you joy and nourishes your spirit with the family. And so if you have the family set, and then you're going to be working on your time management, and there are a million skills that you can learn, and you're going to be feeling overwhelmed. First, because you're a new attending, you don't have anybody looking over your shoulder, and you're bound to feel as though you're worried that you could miss something. If you miss a big diagnosis, people die, and that's frightening. So having somebody that you can talk with, whether it's a colleague or somebody just a couple years ahead of you, or somebody like me who's been out for a few decades, just pull us aside and say, hey, can you help me out? I've got this tough patient. I just want to run by you. That is 100% acceptable in any situation. You want to be careful about when you do it, but it's not going to be in the middle of Grand Round somewhere. But always take the time to find the people that will gently support you and not yell or berate you. Those are important. And then finding a mentor generally, is incredibly valuable early on and something I wish I could have had. So that's why the program that I'm developing with Single Mom MD is we're offering community support so they can come, whether it's once a week for a Zoom meeting or once a month, which it'll ultimately become, or having somebody that they can email and say, can you just let me know, what do I do about this? And it's not about medical questions for patients. It's about, what do I do if my daycare closes a half hour before my job lets me go? Where do I look for help? Things that other moms that have been in the same situation can help you with. And just giving you ideas of things to save you time, to save you money, and to pull you back from that precipice, because overwhelm and depression are so close to all of us when we're feeling that much pressure, especially with a couple $100,000 of student loans bearing down on us.
Yes.
I mean, 5 different reasons why you could be depressed right there.
Right.
So taking care of yourself every day, taking care of your kiddos every day, those are important. Work will get done. If you can't get your notes done, you're going to have to do something like hire a scribe. You do not want to be spending your nights writing notes. It's not okay. Get your work done during the day. And part of it is getting organized. And part of it is the job saying you need to see this many patients a day. And if it's beyond what you're capable of, especially when you first start, you can ask for a little grace then. And so instead of maybe getting 15 patients during your orientation, maybe you could have 10.
Sure.
And if that's too much for you, maybe 7.
Right.
But just keep working with the people at the hospital and your colleagues and whoever recruited you to this great job, because if they're smart, they're going to want to keep you forever.
Right.
So they don't want you to burn out. And I think that's true for any job. But understanding what your expectations are walking in and understanding what their expectations of you is going to be critical for you to be happy or joyful as you get all of these other things taken care of. So the bottom line is take it in baby steps,
right,
in micro bites, but just take it one step at a time and look around and see who can help you.
Yeah, I mean, you kept hitting on that over and over again. Ask for help, get help. Your employer is not going to know that you are on the edge and barely able to keep up if you don't communicate.
It's very true.
Yeah, you need to ask for help.
And I think that goes back to what we were talking about earlier, where it's so difficult for us to ask for help. But I think it actually is a more mature, higher level of thinking when you do, because I think most of us that are older understand what happens to us if we don't. And
right.
That can still happen. That can still happen even if we do get help. But at least having the support as we go can be really valuable.
It's invaluable. In fact, one of the things I really push with my program is the power of community. The program itself is a source of community, but being connected with people who, can intimately know you, be there to support you, love you just the way you are is important, as it is to have a community of colleagues, particularly in the field of medicine or any high-powered professional field, is to have mentors and colleagues that you can lean on from time to time. We're not meant to do life alone, and we're not expected to have all the answers. Knowing where you can get the answers is part of, a big step and part of managing your world.
Absolutely. In fact, I was listening to a seminar earlier today, and he said, you don't have to be a know-it-all. You have to be an I don't know it all, but let's figure it out together.
I believe I heard a statement about, I think it was Einstein, and he couldn't remember or didn't remember phone numbers. And he was asked why he didn't remember phone numbers. And he said, because I can look him up.
Super smart.
You need to know where the resources are and don't think you have to know everything all the time.
I think that one of the most dangerous things in medicine, and maybe even in life, is when you are 100% sure of something and you're wrong. So I make a point of, I've known this for 20 years, so of course it's still true. I'll still go to UpToDate or one of our other medical resources and I'll check, because I don't want to take a chance that what I'm thinking is actually not correct anymore.
And that's for having community and people who know you and who work with you. They can identify when, hey, maybe you're a little bit off track. Whereas if you try and work as an isolated island, you don't have the benefit of the give and take and the discourse that you would have if you engaged with other people.
I think both of our communities are really getting great value from us both understanding that already. So
Yes.
especially so early in our programs.
Yeah, that was a hard fought knowledge that I didn't learn until later on.
But isn't that why we're here, to help the others benefit from our painful learning processes? I think that's why I hope they value us as much as I would value these programs had I had them available to me 30 years ago or
Yes.
25 years ago when I lost my husband. So this kind of thing would have been critical. I mean, it would have literally changed the trajectory of my life.
Sure. And having concrete steps to follow and action that you can take is so important. I know that one of the things I was most frustrated about as a client with therapy is I often felt like we stayed focused on the problem. We talked a lot about the problem, but there weren't concrete solutions for me to take and implement when I got home. And I think the value in our programs is we've been there, done that, and we've learned some skills and tools that we can impart for other people to pick up and use today. They don't have to wait 20 years before there's some epiphany or some major pivot or some major life change that forces you to do something differently. Do it now when you have the opportunity to catch things early.
Absolutely. Otherwise, you end up having all that stored grief and you don't know what to do with it decades later.
Exactly. And not to mention the havoc it places on your body.
Exactly. Especially those of us that suffer with autoimmune diseases, right?
Yeah, definitely. There's a big mind-body link.
So true.
So how can we get a hold of you? How can people interested in what you have to offer find out more and check out your web?
So the easiest way is to reach me. The website is www.singlemommd.org. And then our podcast is Single Mom MD, and that can be found on Spotify, Apple, and Google. And then on Facebook and Instagram, we have Single Mom. So search for us on there and join us in the community. The services that we offer right now include the actual community, a membership, which includes not only what's available as far as services within the website that you'll see there, but also either weekly or monthly Zoom meetings, depending on scheduling. And then we also have the unlimited email access available now, and then individual coaching with me.
Awesome, Dr. Gail. I'm excited for you and for your program and for all the people who take advantage of your services. You are a light bearer and provide a lot of hope for people out there who are struggling. And I encourage you to take advantage of the resources that are out there. SingleMomMD.org, also on Facebook, Instagram, Spotify, Single Mom MD. Gail is ready and willing and wants to help. And as am I. Anybody who is struggling with anxiety or depression or just frustrated with where they are in life and feel like there's something more out there, that they want to go from barely surviving to thriving, you can check out my program at doggonedepression.com. You can check out the website. There's some free tools you can download, and you can email me, reach out, connect to me. You can follow me on my podcasts, the podcast with Dr. Christy. And we both are here to help, willing to help, want to help. You're not alone. Resources are available to you. Thank you for joining us today.
Thank you for having me, Dr. Christy, on your podcast.
Thank you, Dr. Gail. You've been a joy.